More than half of the global population is consuming inadequate levels of essential micronutrients, such as calcium, iron, and vitamin C and E. This alarming statistic comes from a groundbreaking study conducted by researchers at Harvard T.H., Chan School of Public Health, UC Santa Barbara, and the Global Alliance for Improved Nutrition. The study, published in The Lancet Global Health, is the first to provide comprehensive global estimates of inadequate consumption of 15 critical micronutrients. Micronutrient deficiencies are among the most common forms of malnutrition worldwide, leading to severe health consequences, including adverse pregnancy outcomes, blindness, and increased susceptibility to infectious diseases. The study represents a significant advancement in understanding global micronutrient deficiencies. Researchers evaluated whether the intake of these nutrients meets the recommended requirements for human health, focusing on inadequacies across different age and sex groups. "Our study is a big step forward," said co-lead author Chris Free, research professor at UCSB. The researchers utilized data from the Global Dietary Database, the World Bank, and dietary recall surveys from 31 countries to assess nutritional intake among populations in 185 countries. They divided the populations into males and females across 17 age groups, ranging from 0 to over 80 years old. The study found significant intake inadequacies for nearly all evaluated micronutrients, excluding fortification as a potential source of additional nutrients. The study highlighted several micronutrients with particularly high levels of inadequate intake. Iodine deficiency affected 68% of the global population, followed closely by vitamin E at 67%, calcium at 66%, and iron at 65%. More than half of the population consumed inadequate levels of riboflavin, folate, and vitamins C and B6. On the other hand, niacin had the lowest inadequacy rate, with 22% of the global population consuming insufficient levels, followed by thiamine at 30% and selenium at 37%. These deficiencies compromise health outcomes and limit human potential on a global scale, as emphasized by Ty Beal, senior technical specialist at GAIN. The study also revealed disparities in micronutrient intake based on gender and age. Women were found to have higher inadequate intakes of iodine, vitamin B12, iron, and selenium compared to men within the same country and age groups. Conversely, men consumed inadequate levels of calcium, niacin, thiamine, zinc, magnesium, and vitamins A, C, and B6 more frequently than women. Notably, individuals aged 10 to 30, regardless of gender, were most prone to low levels of calcium intake. This trend was particularly evident in South and East Asia and sub-Saharan Africa, as well as across North America, Europe, and Central Asia. The study identified significant regional variations in micronutrient intake. South and East Asia, along with sub-Saharan Africa, exhibited particularly low levels of calcium intake. These regions, along with North America, Europe, and Central Asia, showed concerning patterns of micronutrient inadequacy. The researchers noted that a lack of available data, especially on individual dietary intake worldwide, may have limited their findings. Despite these limitations, the study provides valuable insights into the global landscape of micronutrient deficiencies and highlights the urgent need for targeted interventions. The implications of these findings are profound, presenting both challenges and opportunities for public health practitioners and policymakers. "The public health challenge facing us is immense," said senior author Christopher Golden, associate professor of nutrition and planetary health at Harvard Chan School. However, there is an opportunity to identify the most effective dietary interventions and target them to the populations most in need. By addressing these micronutrient gaps, we can improve health outcomes and unlock human potential on a global scale. The study's data and methods are freely accessible, providing a valuable resource for researchers and practitioners worldwide.